Hi everybody, it's Dr. Hendricks at the Health and Wellness Clinic here in Layton. I have been reading a lot this time of year on some of the dietary things. So many of us, as the new year hits, we want to eat better and exercise better and maybe lose some weight, and I'm in that category. So I've been doing a lot of reading. One of the things that, one article that I read, it was in the European Nutritional Journal about magnesium. Magnesium is very, very important. It's a mineral that we need in our systems, and we just don't get enough of it. And the study that I read talked about how there was, let me read my notes so that I get it right. A 41% increase in magnesium led to better brain health. And so a deficiency in magnesium was more apt to show dementia and early onset dementia. Another thing with magnesium is it really does have an effect on our muscles. It can reduce muscle spasm. If anybody's ever been in preterm labor, one of the things that they give is magnesium sulfate when you go to the hospital to help stop the contractions. Now, it's not just to help stop the contractions, but with magnesium during the pregnancy, you're less likely, the baby is less likely to have cerebral palsy and muscle and neurologic problems. So magnesium is extremely important. It's very inexpensive. And as I tell my patients all the time, take a good multivitamin if you're not every day, because we just don't get enough in our systems anyway. But take a good multivitamin. But if you need to increase it with magnesium, do so. I've already talked about vitamin D if you've watched any of the other videos, but you can get supplements of vitamin D, supplements of magnesium that are very inexpensive. So I highly recommend that for our muscle health and our nerve health. So hope to see you at the Health and Wellness Clinic anytime you need. I'm here when you need me. If you have any questions, feel free to give us a call. Thanks, guys.